Hello and welcome to another edition of a Minnesota Banking Minute. I'm Carla Bush with the Minnesota Bankers Association. I'm joined again today with Steve Kerbaugh from Jackson Lewis, an attorney, to talk about coronavirus screening. Steve, can you share with us some best practices for setting up a coronavirus screening program in your bank?
Absolutely. The first thing you want to do is you want to identify the scope of the screening program, and it should be limited to trying to determine whether there are coronavirus-related risks. A second important thing is to identify a person and or team of people who are going to be responsible for administering the screening program. That's important for a couple of different reasons. First of all, you want to make sure that the program is uniformly applied throughout your branches and other locations. And second of all, you want to make sure that that team or that person is staying on top of guidance that's being issued really at kind of a breakneck speed by a lot of governmental agencies, whether it be the CDC, the EEOC, OSHA, the Minnesota Department of Health, MINOSHA, the Minnesota Department of Labor and Industry, you name it. There's a lot of information that's coming across the transom when it comes down to screening protocols. So it's important to stay on top of those. You want to make sure that screening is conducted as privately as possible to make sure that the privacy interests of individuals and their confidential information is maintained, and that others can't, for example, overhear the results of another employee or individual who's being screened and the results of that screening. You're also going to want to make sure that an appropriate person is conducting the screening. If it is a healthcare professional, that's great. Licensed, practical nurse, for example, might be an appropriate person. With regard to healthcare professionals, you do want to make sure that they're licensed or certified. You also want to make sure that they're using the appropriate personal protective equipment and that they're appropriately trained. With professionals, that's typically not as big of an issue. But with regard to employees, if an employee is going to be doing the screening, you want to make sure that they're using the appropriate equipment and that they're appropriately trained. And it may be appropriate to consult with, for example, an OSHA lawyer to make sure that they're up to speed on what should be done in a testing or screening situation. Another thing you want to do is if you've got an employee who is participating in the screening process, you want to make sure that that employee is one who can be trusted with confidential information and will be discreet about it. And typically you want to make sure that that employee is also one whom the employees are going to trust with that process. For example, maybe somebody in HR or management might be a good fit for that. You'll also want to make sure that appropriate social distancing is maintained when it comes down to screening procedures. There should typically be 6 feet within individuals. If there are barriers, all the better. You probably want to make sure that you're using a temperature taking mechanism that allows for temperatures to be taken at a distance if that's feasible. Regardless of what kind of mechanism you're using, though, you want to make sure that it's accurate and you want to make sure that it's appropriately cleaned or sterilized after every use. You're also going to want to make sure that whatever testing that you're doing is being done consistently. If one person gets tested, generally everybody should get tested. You shouldn't be selective with regard to who gets tested. And also you want to make sure that you're being consistent with regard to the method of testing and also what's being done with the information that's collected as a result of that testing. Otherwise, you might inadvertently run afoul of anti-discrimination laws. Typically, you'll also want to make sure that employees are compensated for the time that it takes for them to be screened, whether that be while filling out their self-certifications or getting their temperature taken or standing in line to do the same if employees are coming into the building at the same time, for example, in the morning. And of course, I would be remiss if I didn't say that you want to make sure that your screening program complies with all federal, state, local laws, rules, regulations regarding, privacy and regarding health and safety and regarding, just general employee issues and payment issues in general too.
That's really great information, Steve. So finally, tell me, what should a bank do if it determines one of its employees has a temperature or is otherwise potentially ill?
Yeah, the first and most important step is to try to isolate that employee and make sure that there's not exposure to others in the workplace. for everybody's safety. And then simply to ask that employee to go home. Employees who are experiencing symptoms or who are otherwise at risk should follow the CDC's guidelines with regard to self-isolation and should typically not come back to the workplace until those guidelines have been fully complied with or there's a negative test result. I do note that the CDC and the EEOC have both indicated that employers, though, should not require doctor's notes or potentially even negative test results when it comes down to return to work. And the purpose for that is presumably because healthcare providers are so busy that oftentimes obtaining those notes may be difficult and not feasible. Another thing you want to keep in mind when an individual gets sent home because they're experiencing symptoms or otherwise at risk is that you may need to compensate that individual. It's important to keep track of local sick and safe time ordinances, and also federal laws like the FMLA and the Families First Coronavirus Response Act, for example. There's kind of a patchwork of law at all levels that can apply to sick and safe time leave. And also you want to be true to your own policies and make sure that those are adhered to with regard to paid time off and sick leave. And generally, if an employee should be compensated under the law or the policy, you need to make sure that they're being compensated for their time off after they've been sent home or otherwise asked to, remain away from the workplace as a function of, potentially being at risk for coronavirus.
That's it, what we have. Thank you so much, Steve, for joining us and sharing this valuable information. For more information, you can visit the COVID-19 resource page at minbankers.com, including resources from Jackson Lewis, MBA's associate member. Thank you.